Hello, future healthcare professionals. Welcome to Nursing Exam Preparation, your trusted partner in mastering essential nursing knowledge. In today's video, we'll be guiding you through 250 true-false questions focused on interventions for heart failure patients, a critical area that blends clinical expertise, compassion, and evidence-based practices to manage and improve the lives of patients with heart failure. Each question has been carefully crafted to assess your understanding of heart failure management, from acute interventions to long-term care strategies. After every question, we'll provide a detailed rationale for the correct answer, helping you understand not only the what, but also the important why behind each intervention. Whether you're just beginning to explore cardiovascular nursing or preparing for your upcoming exams, this video is packed with essential knowledge designed to strengthen your clinical reasoning, boost your confidence, and prepare you for success. Don't forget to like, share, and subscribe to Nursing Exam Preparation for more valuable resources to support your learning journey. Hit the bell icon to stay updated with our latest videos. We are committed to helping you succeed with practical, engaging content. Once you've completed the quiz, share your score in the comments below. We're excited to celebrate your progress. Let's dive in and take another step toward becoming a skilled healthcare professional, equipped with a strong understanding of heart failure interventions. Ready? Let's begin. 1. Beta blockers are commonly prescribed to improve heart function in heart failure patients. True or false? Answer: true. Rationale: beta blockers are commonly prescribed for heart failure patients as they help to decrease the workload on the heart by reducing heart rate and improving myocardial function. This class of drugs is particularly useful in reducing hospitalizations and mortality, especially in patients with systolic heart failure. 2. Diuretics are used in heart failure to decrease fluid volume and reduce symptoms of congestion. True or false? Answer: true. Rationale: diuretics are a mainstay in the management of heart failure as they help alleviate symptoms of fluid retention, such as edema and pulmonary congestion, by promoting fluid excretion. This reduces the strain on the heart and helps patients breathe more easily. 3. Invasive procedures like heart transplants are the first-line treatment for all heart failure patients. True or false? Answer: false. Rationale: heart transplants are reserved for patients with end-stage heart failure who are unresponsive to medical management and have no other treatment options available. They are not the first-line treatment, as many patients benefit from pharmacologic treatments and lifestyle changes before considering a transplant. 4. ACE inhibitors are used to relax blood vessels and reduce the workload on the heart in heart failure. True or false? Answer: true. Rationale: ACE inhibitors are frequently prescribed in heart failure because they dilate blood vessels, reduce blood pressure, and decrease the workload on the heart. They also help prevent fluid retention and may improve symptoms of heart failure by blocking the renin-angiotensin-aldosterone system, RAS. 5. Salt restriction is an unnecessary intervention for heart failure patients. True or false? Answer: false. Rationale: salt restriction is a key intervention for heart failure patients as excess sodium can lead to fluid retention, worsening symptoms such as edema and pulmonary congestion. Sodium restriction helps control blood pressure and reduces the strain on the heart. 6. The use of vasodilators like nitrates can help reduce afterload and alleviate symptoms in heart failure patients. True or false? Answer: true. Rationale: vasodilators, including nitrates, can be used to relax blood vessels, reducing afterload, the resistance the heart must overcome to pump blood. This can help alleviate symptoms such as shortness of breath in patients with heart failure, especially those with high blood pressure or pulmonary edema. 7. In patients with heart failure, exercise should be avoided as it can exacerbate symptoms. True or false? Answer: false. Rationale: exercise, when properly managed, can be beneficial for heart failure patients. It improves cardiovascular fitness, reduces symptoms, and enhances quality of life. A supervised, gradual exercise program is often recommended to help improve endurance and function without overloading the heart. 8. Left ventricular assist devices, LVADs, are typically used as a long-term solution for heart failure. True or false? Answer: false. Rationale: LVADs are typically used as a short-term solution in patients awaiting a heart transplant or as a bridge to recovery in certain cases. While they can be used long-term in some patients, they are not considered a definitive, permanent solution for heart failure. 9. Anticoagulants are routinely prescribed in all heart failure patients to prevent blood clots. True or false? Answer: false. Rationale: anticoagulants are not routinely prescribed for all heart failure patients. They are generally reserved for patients with additional risk factors for clot formation, such as atrial fibrillation or a history of thromboembolism. Routine anticoagulation in all heart failure patients is not standard practice. 10. A key goal in the nursing management of heart failure patients is to monitor for signs of fluid overload, such as weight gain and swelling. True or false? Answer: true. Rationale: monitoring for signs of fluid overload, such as rapid weight gain, edema, and shortness of breath, is a critical aspect of nursing management in heart failure. Early detection of fluid retention can help prevent exacerbations and guide appropriate interventions. 11. Digoxin is used in heart failure to increase the heart rate and improve contractility. True or false? Answer: false. Rationale: digoxin works by slowing the heart rate and increasing the force of myocardial contraction. It is used in heart failure to improve heart function and reduce symptoms, particularly in patients with atrial fibrillation. It does not increase the heart rate, but helps the heart pump more effectively. 12. Fluid balance education is an important part of heart failure patient care. True or false? Answer: true. Rationale: fluid balance education is crucial in managing heart failure, as patients must understand how to monitor their fluid intake and identify signs of fluid retention. Proper education helps reduce hospitalizations and improves adherence to treatment plans. 13. Statins are commonly used to treat heart failure by lowering cholesterol levels, which improves heart function. True or false? Answer: false. Rationale: while statins are effective in lowering cholesterol levels, they are not commonly used to treat heart failure directly. Their primary role is in managing cardiovascular risk factors, such as hyperlipidemia, but they do not significantly improve heart failure symptoms or outcomes. 14. A low-sodium diet is only recommended for patients with severe heart failure. True or false? Answer: false. Rationale: a low-sodium diet is recommended for all heart failure patients, regardless of the severity of the disease. Sodium restriction helps prevent fluid retention and reduces the risk of exacerbating heart failure symptoms. 15. A heart failure management plan typically includes regular follow-ups to assess disease progression and medication effectiveness. True or false? Answer: true. Rationale: regular follow-ups are essential in the management of heart failure to monitor for disease progression, assess the effectiveness of medications, and make adjustments as needed. These visits also provide an opportunity to reinforce lifestyle changes and improve patient adherence to treatment. 16. Spironolactone is commonly used in heart failure to prevent potassium loss caused by diuretics. True or false? Answer: true. Rationale: spironolactone is a potassium-sparing diuretic often prescribed in heart failure to counteract potassium loss from other diuretics, such as furosemide. It also blocks aldosterone, which helps prevent fluid retention and improves outcomes in heart failure patients. 17. Heart failure patients are advised to increase their fluid intake to prevent dehydration. True or false? Answer: false. Rationale: heart failure patients are often advised to limit their fluid intake to prevent fluid overload, as excessive fluid can exacerbate symptoms such as edema and shortness of breath. Fluid restriction is typically part of the management plan, depending on the patient's condition. 18. In patients with heart failure, oxygen therapy is often used during acute exacerbations to improve oxygen saturation. True or false? Answer: true. Rationale: oxygen therapy is commonly used during acute heart failure exacerbations to improve oxygenation and relieve symptoms of hypoxia, especially in patients with pulmonary edema or significant respiratory distress. 19. Prolonged bed rest is beneficial in treating acute heart failure exacerbations. True or false? Answer: false. Rationale: prolonged bed rest is generally not recommended for heart failure patients. Early mobilization and gradual activity are important for improving circulation, preventing complications such as thromboembolism, and enhancing the patient's recovery. 20. The use of beta agonists is recommended in heart failure for increasing heart contractility and improving symptoms. True or false? Answer: false. Rationale: beta agonists, which stimulate beta receptors, are typically avoided in heart failure patients as they can increase heart rate and oxygen demand, potentially worsening heart failure. Medications like beta blockers are preferred to manage symptoms and improve outcomes. 21. An implantable cardioverter defibrillator, ICD, is used in heart failure patients who are at high risk for life-threatening arrhythmias. True or false? Answer: true. Rationale: an ICD is often recommended for heart failure patients who have a high risk of sudden cardiac arrest due to arrhythmias. It continuously monitors heart rhythms and delivers shocks to restore normal rhythm if necessary. 22. Heart failure patients with diabetes should avoid blood sugar management to prevent exacerbating their condition. True or false? Answer: false. Rationale: proper blood sugar management is essential for heart failure patients with diabetes. Uncontrolled blood glucose levels can worsen heart failure symptoms and contribute to other comorbidities such as kidney disease, which exacerbates heart failure. 23. In heart failure, a patient's renal function should be regularly monitored, as certain medications can impact kidney function. True or false? Answer: true. Rationale: regular monitoring of renal function is crucial in heart failure patients, especially those on medications like ACE inhibitors, diuretics, and certain vasodilators, which can affect kidney function. This helps prevent complications such as renal impairment or electrolyte imbalances. 24. Heart failure patients are typically prescribed low-fat diets to reduce the risk of cardiovascular disease. True or false? Answer: true. Rationale: a low-fat diet is often recommended to heart failure patients to reduce the risk of further cardiovascular disease, especially since heart failure is commonly associated with coronary artery disease. Reducing saturated fats can help manage cholesterol levels and prevent additional strain on the heart. 25. Avoiding stress is an essential aspect of heart failure management. True or false? Answer: true. Rationale: stress management is crucial for heart failure patients, as stress can lead to increased heart rate, blood pressure, and ultimately greater workload on the heart. Techniques such as relaxation, deep breathing, and guided therapy are often recommended to reduce stress levels. 26. In advanced heart failure, palliative care may be appropriate to focus on comfort rather than curative treatments. True or false? Answer: true. Rationale: palliative care plays a vital role in advanced heart failure, focusing on symptom management, pain relief, and improving the quality of life. It is appropriate when curative treatments are no longer effective or feasible, particularly in end-stage heart failure. 27. Cardiac resynchronization therapy, CRT, is used to coordinate the contraction of both ventricles in patients with heart failure and a wide QRS complex. True or false? Answer: true. Rationale: cardiac resynchronization therapy, CRT, involves using a special pacemaker to synchronize the contractions of the left and right ventricles, improving heart efficiency in patients with heart failure and abnormal electrical activity, such as a wide QRS complex. 28. A heart failure patient with persistent hypokalemia should continue taking their prescribed diuretics without adjustment. True or false? Answer: false. Rationale: persistent hypokalemia in heart failure patients is concerning, especially when taking diuretics, as it can lead to serious complications like arrhythmias. Potassium levels should be carefully monitored, and adjustments to diuretic therapy or supplementation may be required. 29. Eating small, frequent meals is recommended for heart failure patients who experience early satiety due to abdominal distension. True or false? Answer: true. Rationale: small, frequent meals are recommended for heart failure patients with abdominal distension, as large meals can increase pressure on the diaphragm and worsen symptoms such as shortness of breath and early satiety. Smaller meals are easier to digest and help prevent discomfort. 30. Patients with heart failure should be educated about the importance of daily weight monitoring to detect early signs of fluid retention. True or false? Answer: true. Rationale: daily weight monitoring is crucial for heart failure patients to detect early signs of fluid retention. A sudden increase in weight may indicate worsening fluid overload, prompting timely adjustments to medications or diet to prevent further complications. 31. Non-steroidal anti-inflammatory drugs, NSAIDs, are safe for heart failure patients to use for pain relief. True or false? Answer: false. Rationale: NSAIDs are generally contraindicated in heart failure patients because they can cause sodium and water retention, increasing the risk of fluid overload and worsening heart failure symptoms. Alternative pain management strategies are preferred. 32. Endurance training in heart failure patients can improve functional capacity and quality of life. True or false? Answer: true. Rationale: endurance training has been shown to improve the functional capacity, exercise tolerance, and overall quality of life for heart failure patients. It helps improve cardiovascular efficiency, muscle strength, and physical endurance, all without overburdening the heart. 33. The use of anticoagulants in heart failure patients without atrial fibrillation is generally unnecessary. True or false? Answer: true. Rationale: anticoagulants are typically prescribed to heart failure patients with atrial fibrillation or those at high risk of thromboembolism. In the absence of these conditions, the risk of blood clots is lower, and anticoagulants are usually not indicated. 34. A heart failure patient's lifestyle should include daily physical activity to improve cardiovascular health. True or false? Answer: true. Rationale: daily physical activity, within a patient's tolerance, is encouraged to improve cardiovascular health and enhance overall function. Regular exercise helps strengthen the heart muscle, improve circulation, and decrease the risk of hospitalization. 35. Patients with heart failure should be encouraged to take their medications exactly as prescribed to prevent exacerbations. True or false? Answer: true. Rationale: adherence to prescribed medications is essential for managing heart failure effectively. Medications like ACE inhibitors, beta blockers, and diuretics are key to preventing exacerbations, reducing hospitalizations, and improving overall outcomes in heart failure patients. 36. Atrial fibrillation is a common arrhythmia seen in patients with heart failure and requires specific management strategies. True or false? Answer: true. Rationale: atrial fibrillation is commonly seen in heart failure patients, particularly those with left ventricular dysfunction. Its management typically includes rate control, anticoagulation, and addressing the underlying heart failure to reduce the risk of stroke and improve overall heart function. 37. Angiotensin II receptor blockers, ARBs, are an alternative to ACE inhibitors for heart failure patients who are intolerant to ACE inhibitors. True or false? Answer: true. Rationale: ARBs are commonly used in place of ACE inhibitors for patients who experience adverse effects like persistent cough. Both ARBs and ACE inhibitors work by blocking the renin-angiotensin-aldosterone system, RAS, helping to reduce blood pressure and fluid retention in heart failure patients. 38. When using diuretics in heart failure patients, potassium supplements are generally not required. True or false? Answer: false. Rationale: potassium supplements are often required for heart failure patients on diuretics, particularly those taking loop diuretics, e.g., furosemide, which can cause significant potassium loss. Monitoring potassium levels and supplementation may be necessary to avoid hypokalemia. 39. Aldosterone antagonists, like eplerenone, are beneficial for heart failure patients by reducing the risk of arrhythmias and improving outcomes. True or false? Answer: true. Rationale: aldosterone antagonists such as eplerenone are beneficial in heart failure because they help counteract the effects of aldosterone, which can contribute to fluid retention and myocardial fibrosis. These medications help reduce the risk of arrhythmias and improve long-term survival. 40. Digoxin should be routinely prescribed to all heart failure patients to enhance contractility. True or false? Answer: false. Rationale. While digoxin can be beneficial in certain heart failure patients, especially those with atrial fibrillation, it is not routinely prescribed for all heart failure patients. It is typically used in specific cases where there is a need for rate control or symptom relief in systolic heart failure. 41. Patients with heart failure should avoid any type of alcohol to prevent exacerbating their condition. True or false? Answer: false. Rationale. While excessive alcohol consumption should be avoided, moderate alcohol intake is not always contraindicated in heart failure patients. It's important to individualize care, as alcohol can worsen heart failure symptoms in some patients, but moderate use may not be harmful for others. 42. Sodium intake should be limited to no more than 1,500 milligrams per day for most heart failure patients. True or false? Answer: true. Rationale. Sodium restriction is an important aspect of managing heart failure. The recommended limit of 1,500 milligrams of sodium per day helps reduce fluid retention and manage blood pressure, preventing exacerbations of heart failure. 43. In heart failure management, patient education about medication adherence is essential to improve outcomes. True or false? Answer: true. Rationale. Patient education about the importance of medication adherence is crucial for heart failure patients. Proper adherence to prescribed medications, such as diuretics, ACE inhibitors, and beta blockers, helps prevent symptom exacerbation, reduces hospitalizations, and improves overall survival. 44. Left ventricular ejection fraction, LVEF, is an important parameter for assessing the severity of heart failure. True or false? Answer: true. Rationale. Left ventricular ejection fraction, LVEF, is a critical measure of heart function and a key factor in diagnosing and classifying heart failure. A reduced LVEF is indicative of systolic heart failure and helps guide treatment decisions. 45. Weight loss is a recommended treatment for heart failure patients who are overweight or obese. True or false? Answer: true. Rationale. Weight loss is beneficial for heart failure patients who are overweight or obese, as it can help reduce the strain on the heart, improve exercise capacity, and reduce other comorbidities such as hypertension and diabetes. 46. In heart failure patients, the use of non-pharmacologic therapies such as relaxation techniques and stress management can improve overall outcomes. True or false? Answer: true. Rationale. Non-pharmacologic therapies, including stress management techniques like relaxation exercises, meditation, and breathing exercises, can help reduce the impact of stress on the heart and improve overall outcomes in heart failure patients. 47. A patient with heart failure and a history of smoking should be advised to quit smoking, as it worsens heart function. True or false? Answer: true. Rationale. Smoking is a major risk factor for worsening heart failure, as it increases the workload on the heart, contributes to vascular damage, and reduces oxygen supply. Quitting smoking is one of the most important lifestyle changes for heart failure patients. 48. The use of corticosteroids is recommended in heart failure for anti-inflammatory effects. True or false? Answer: false. Rationale. Corticosteroids are not typically used in heart failure because they can cause fluid retention, worsen hypertension, and increase the risk of exacerbating heart failure symptoms. Anti-inflammatory treatments are generally avoided unless there is another condition requiring corticosteroid use. 49. A heart failure patient who is unable to take oral medications can be treated with intravenous, 4. medications like furosemide in the hospital setting. True or false? Answer: true. Rationale. In patients with severe heart failure who cannot tolerate oral medications, intravenous, 4. diuretics like furosemide may be administered to rapidly reduce fluid overload. For medications are often used in acute settings for more immediate relief. 50. Non-invasive positive pressure ventilation, NIPPV, can be used in heart failure patients with acute pulmonary edema to improve oxygenation. True or false? Answer: true. Rationale. Non-invasive positive pressure ventilation, NIPPV, such as CPAP or BiPAP, is commonly used in heart failure patients with acute pulmonary edema to improve oxygenation, decrease the work of breathing, and reduce the need for intubation. 51. A heart failure patient should avoid all types of exercise, even light activities, due to the risk of exacerbating symptoms. True or false? Answer: false. Rationale: regular, light physical activity is recommended for heart failure patients to improve cardiovascular fitness, strength, and overall health. A structured, supervised exercise program can help improve functional capacity without overloading the heart. 52. Electrolyte imbalances, such as low sodium or potassium, can occur in heart failure patients due to diuretics and need to be monitored regularly. True or false? Answer: true. Rationale: electrolyte imbalances, especially hypokalemia and hyponatremia, are common in heart failure patients due to diuretic use. Regular monitoring of electrolytes is necessary to prevent complications such as arrhythmias or muscle weakness. 53. In advanced heart failure, a heart transplant is the only effective treatment option. True or false? Answer: false. Rationale: while a heart transplant may be considered in advanced heart failure, it is not the only option. Other treatments, such as left ventricular assist devices, LVADs, palliative care, or even experimental therapies, may also be appropriate depending on the patient's situation. 54. Hydralazine and isosorbide dinitrate are used in heart failure to reduce afterload and improve symptoms. True or false? Answer: true. Rationale: hydralazine and isosorbide dinitrate are vasodilators used in heart failure to reduce afterload, resistance, and preload fluid volume, which can improve symptoms, especially in patients who are unable to tolerate ACE inhibitors or ARBs. 55. Patients with heart failure and hypertension are encouraged to maintain their blood pressure below 140/90 mmHg. True or false? Answer: true. Rationale: controlling blood pressure is essential in heart failure management, especially in patients with both heart failure and hypertension. Maintaining a blood pressure below 140/90 mmHg helps reduce the strain on the heart and prevent disease progression. 56. Statins are commonly prescribed to heart failure patients to lower cholesterol levels and improve heart function. True or false? Answer: false. Rationale: while statins are beneficial in managing cardiovascular risk factors like high cholesterol, they are not primarily used to treat heart failure. Their role is more focused on preventing coronary artery disease progression rather than improving heart function in heart failure. 57. Sleep apnea treatment, such as continuous positive airway pressure, CPAP, can improve heart failure symptoms. True or false? Answer: true. Rationale: treatment for sleep apnea, especially with CPAP, can improve heart failure symptoms by increasing oxygen levels, reducing the risk of arrhythmias, and improving sleep quality, which can enhance overall cardiovascular health. 58. High-protein diets are recommended for heart failure patients to prevent muscle wasting. True or false? Answer: true. Rationale: a high-protein diet can help prevent muscle wasting in heart failure patients, particularly those with cachexia, muscle wasting. Protein helps maintain muscle mass and improve physical strength, which is vital for overall function and quality of life. 59. Patients with heart failure should be instructed to monitor their blood pressure regularly at home. True or false? Answer: true. Rationale: regular blood pressure monitoring is crucial in managing heart failure. Monitoring at home helps detect early signs of worsening hypertension or hypotension, allowing for timely interventions and adjustments to treatment. 60. Beta blockers should not be used in heart failure patients due to their negative effects on heart function. True or false? Answer: false. Rationale: beta blockers are commonly prescribed to heart failure patients because they help reduce heart rate, lower blood pressure, and improve heart function over time by decreasing the workload on the heart. They are beneficial in both chronic and acute heart failure management. 61. A heart failure patient should be encouraged to limit salt intake to reduce fluid retention. True or false? Answer: true. Rationale: Reducing sodium intake is critical in heart failure management as it helps prevent fluid retention, which can worsen symptoms like edema and shortness of breath. Sodium restriction typically helps manage blood pressure and reduce the workload on the heart. 62. Use of nitrates in heart failure is to increase preload and worsen congestion.
True or false?
Answer: false. Rationale: nitrates are used in heart failure to decrease preload by dilating veins, thus reducing the amount of blood returning to the heart. This can help alleviate symptoms of congestion and pulmonary edema, not worsen them. 63. Cardiac rehabilitation programs are beneficial for heart failure patients by improving physical endurance and heart function. True or false? Answer: true. Rationale: cardiac rehabilitation programs are highly beneficial for heart failure patients. They improve physical endurance, muscle strength, and cardiovascular function, helping patients manage symptoms and improve their quality of life. 64. The use of anticoagulants is recommended for heart failure patients with atrial fibrillation to prevent stroke. True or false? Answer: true. Rationale: anticoagulants, such as warfarin or newer oral anticoagulants, are commonly prescribed for heart failure patients with atrial fibrillation to reduce the risk of thromboembolism and stroke, as irregular heart rhythms increase the risk of clot formation. 65. A heart failure patient should be instructed to elevate their legs to reduce swelling and improve venous return. True or false? Answer: true. Rationale: elevating the legs can help reduce swelling, edema, in heart failure patients by improving venous return to the heart and reducing fluid accumulation in the lower extremities, thus relieving discomfort and improving circulation. 66. The use of a left ventricular assist device, LVAD, can be a temporary solution for heart failure patients awaiting a heart transplant. True or false? Answer: true. Rationale: an LVAD is often used as a bridge to heart transplant, providing mechanical support to the heart when it is unable to pump blood effectively. It can be a temporary solution for patients while they await a heart transplant or in cases of advanced heart failure. 67. A heart failure patient should be advised to avoid all physical activity to prevent stress on the heart.
True or false?
Answer: false. Rationale: regular, moderate physical activity is beneficial for heart failure patients to improve cardiovascular fitness, strength, and overall quality of life. While overexertion should be avoided, light exercise is generally encouraged. 68. Heart failure patients who experience a sudden weight gain should report this to their healthcare provider immediately. True or false? Answer: true. Rationale: sudden weight gain, especially over a short period, e.g., more than 2 to 3 pounds in one day, can indicate fluid retention, which may signal worsening heart failure. It is important for patients to report these changes promptly to adjust treatment and prevent complications. 69. In heart failure, the use of potassium-sparing diuretics like spironolactone can help reduce the risk of hypokalemia. True or false? Answer: true. Rationale: potassium-sparing diuretics, such as spironolactone, are used in heart failure to help retain potassium while removing excess fluid. They are often prescribed alongside other diuretics to prevent hypokalemia and improve outcomes. 70. A heart failure patient with renal dysfunction may need a reduced dose of ACE inhibitors to avoid worsening kidney function.
True or false?
Answer: true. Rationale: ACE inhibitors can affect renal function, particularly in patients with pre-existing kidney disease. It is essential to monitor renal function and adjust doses accordingly to prevent further kidney damage. 71. Non-invasive ventilation, e.g., CPAP, is contraindicated in heart failure patients with obstructive sleep apnea.
True or false?
Answer: false. Rationale: non-invasive ventilation, such as CPAP, is commonly used to treat obstructive sleep apnea in heart failure patients. CPAP improves oxygenation and can reduce the risk of arrhythmias and heart failure exacerbations, improving overall quality of life. 72. Weight management in heart failure patients is not important as long as they adhere to their medication regimen. True or false? Answer: false. Rationale: Weight management is crucial in heart failure patients, especially those who are overweight or obese. Excess weight increases the strain on the heart and worsens heart failure symptoms. A balanced diet and regular exercise are recommended for managing weight and improving heart function. 73. A heart failure patient should avoid taking herbal supplements such as ginseng or hawthorn without consulting their healthcare provider.
True or false?
Answer: true. Rationale: many herbal supplements, including ginseng and hawthorn, can interact with heart failure medications or exacerbate symptoms. It's important for patients to consult their healthcare provider before using any supplements to avoid harmful interactions or complications. 74. Heart failure patients with preserved ejection fraction, HFpEF, should be treated with the same pharmacologic therapies as those with reduced ejection fraction, HFrEF. True or false? Answer: false. Rationale: HFpEF and HFrEF require different treatment approaches. While both types benefit from lifestyle changes and symptom management, HFpEF typically focuses on controlling comorbidities, e.g., hypertension, diabetes, and managing symptoms, while HFrEF treatment often involves medications that improve heart contractility, such as ACE inhibitors and beta blockers. 75. An adequate fluid balance should be maintained in heart failure patients to prevent dehydration. True or false? Answer: false. Rationale: while dehydration can worsen heart failure symptoms, fluid balance must be carefully managed in heart failure patients to prevent fluid overload. Patients are typically advised to monitor fluid intake and output closely to avoid exacerbating symptoms like edema and pulmonary congestion. 76. In heart failure, early recognition of exacerbations and prompt intervention can prevent hospitalization and improve outcomes.
True or false?
Answer: true. Rationale: early recognition of symptoms such as increased shortness of breath, fatigue, or sudden weight gain allows for timely intervention, potentially preventing the need for hospitalization and improving long-term outcomes by reducing complications. 77. The main goal of pharmacologic treatment for heart failure is to cure the condition and restore normal heart function.
True or false?
Answer: false. Rationale: the main goal of pharmacologic treatment in heart failure is to manage symptoms, prevent progression, and improve quality of life, rather than to cure the condition. While treatments such as ACE inhibitors, beta blockers, and diuretics can improve heart function, they do not cure heart failure. 78. In heart failure, a low-sodium diet is most beneficial for controlling hypertension. True or false? Answer: true. Rationale: a low-sodium diet is essential in heart failure, particularly for controlling hypertension. Sodium increases fluid retention, which can elevate blood pressure and exacerbate symptoms. A reduced sodium intake helps lower blood pressure and decrease the heart's workload. 79. High-fiber diets are recommended for heart failure patients to promote digestive health and prevent constipation.
True or false?
Answer: true. Rationale: a high-fiber diet is recommended for heart failure patients to promote digestive health and prevent constipation, which is common in patients taking diuretics. Additionally, fiber helps manage cholesterol levels and can contribute to overall heart health. 80. Chronic use of beta blockers in heart failure patients can help reverse heart remodeling and improve survival.
True or false?
Answer: true. Rationale: beta blockers have been shown to reduce heart remodeling, e.g., ventricular dilation and hypertrophy, and improve survival in heart failure patients. By blocking sympathetic stimulation, they reduce the heart's workload and help prevent further damage. 81. Heart failure patients with fluid retention should be encouraged to increase their fluid intake to promote kidney function.
True or false?
Answer: false. Rationale: fluid intake is often restricted in heart failure patients with fluid retention to prevent worsening symptoms. Fluid overload can exacerbate heart failure symptoms, so fluid intake should be monitored carefully and adjusted based on the patient's condition and treatment plan. 82. Patients with heart failure should monitor their blood pressure regularly, as changes can indicate worsening of the condition.
True or false?
Answer: true. Rationale: Monitoring blood pressure is critical for heart failure patients, as both elevated and low blood pressure can indicate worsening heart failure or the effects of medications. Regular monitoring allows for timely interventions and adjustments to treatment plans. 83. Phosphodiesterase inhibitors, such as milrinone, are used in acute heart failure to improve cardiac output. True or false? Answer: true. Rationale: phosphodiesterase inhibitors like milrinone are used in acute heart failure to improve cardiac output by increasing contractility and promoting vasodilation. They are typically used in the short term for patients with severe symptoms and low blood pressure. 84. Omega-3 fatty acids are commonly recommended for heart failure patients as they help reduce inflammation and improve heart function.
True or false?
Answer: true. Rationale: omega-3 fatty acids have anti-inflammatory effects and can improve cardiovascular health. For heart failure patients, they can help reduce systemic inflammation, lower triglyceride levels, and support overall heart function. 85. Beta blockers should not be used in heart failure patients with a history of asthma due to the risk of bronchospasm.
True or false?
Answer: true. Rationale: beta blockers can cause bronchospasm, especially in patients with asthma or chronic obstructive pulmonary disease, COPD. However, cardioselective beta blockers, e.g., metoprolol, may be used with caution in such patients, as they are less likely to affect the lungs. 86. In patients with heart failure, a restrictive fluid intake is recommended to manage fluid overload and prevent symptoms.
True or false?
Answer: true. Rationale: restricting fluid intake in heart failure patients helps prevent fluid overload, which can exacerbate symptoms like edema, pulmonary congestion, and shortness of breath. Fluid intake should be closely monitored and adjusted based on the patient's condition and treatment goals. 87. Left ventricular assist devices, LVADs, are only used for patients who are not candidates for heart transplantation.
True or false?
Answer: false. Rationale: LVADs are used both as a bridge to heart transplantation and as a long-term solution for patients who are not candidates for transplant, providing mechanical support to the failing heart. They can be used for chronic heart failure management in some cases. 88. When managing heart failure with preserved ejection fraction, HFpF, the primary treatment focus is on controlling comorbidities, such as hypertension and diabetes.
True or false?
Answer: true. Rationale: HFpF is primarily managed by controlling comorbidities, such as hypertension, diabetes, and obesity. While there is no specific treatment that reverses HFpF, addressing these underlying conditions helps manage symptoms and prevent disease progression. 89. In heart failure patients, a reduced sodium intake is only necessary in cases of acute decompensation.
True or false?
Answer: false. Rationale: sodium restriction is a key long-term management strategy in heart failure, not just during acute decompensation. Reducing sodium intake helps minimize fluid retention and manage blood pressure, preventing exacerbations and improving overall outcomes. 90. The use of hydralazine and nitrates in heart failure is particularly beneficial for African American patients. True or false? Answer: true. Rationale: hydralazine and nitrates have been shown to be particularly beneficial in reducing mortality in African American patients with heart failure. This combination therapy helps decrease preload and afterload, improving symptoms and outcomes in this population. 91. Angiotensin receptor neprilysin inhibitors, ARNIs, are an effective treatment option for heart failure with reduced ejection fraction, HFrEF.
True or false?
Answer: true. Rationale: angiotensin receptor neprilysin inhibitors, e.g., sacubitril/valsartan, are an effective treatment for HFrEF. They combine the benefits of RAS inhibition and neprilysin inhibition, improving heart function, reducing hospitalizations, and improving survival in HFrEF patients. 92. Patients with heart failure should be routinely monitored for signs of depression and anxiety, as these conditions can worsen outcomes.
True or false?
Answer: true. Rationale: depression and anxiety are common in heart failure patients and can worsen symptoms, affect medication adherence, and reduce overall quality of life. Routine screening and appropriate interventions can improve patient outcomes and overall well-being. 93. It is essential for heart failure patients to avoid over-the-counter cold medications, as they can worsen fluid retention and blood pressure. True or false? Answer: true. Rationale: many over-the-counter cold medications, particularly those containing decongestants like pseudoephedrine, can cause vasoconstriction, elevate blood pressure, and promote fluid retention, which can exacerbate heart failure symptoms. 94. In heart failure, a high-protein diet is recommended to help prevent malnutrition and muscle wasting. True or false? Answer: true. Rationale: a high-protein diet helps prevent malnutrition and muscle wasting, cachexia, in heart failure patients. Adequate protein intake supports muscle mass and strength, which is important for functional capacity and overall health. 95. Beta blockers are contraindicated in heart failure patients due to their negative inotropic effect. True or false? Answer: false. Rationale: beta blockers are actually beneficial in heart failure patients because they reduce the heart's workload by decreasing heart rate and blood pressure. Despite their negative inotropic effect, they improve survival and reduce hospitalizations in heart failure patients. 96. In patients with heart failure, high doses of loop diuretics can lead to ototoxicity, particularly if administered too rapidly. True or false? Answer: true. Rationale: high doses of loop diuretics, particularly when administered rapidly via intravenous injection, can cause ototoxicity, leading to hearing loss or tinnitus. Diuretics should be used cautiously and at the appropriate doses to avoid this side effect. 97. Heart failure patients should be encouraged to avoid taking any medication without consulting their healthcare provider, including over-the-counter medications. True or false? Answer: true. Rationale: heart failure patients should avoid self-medicating with over-the-counter medications without consulting their healthcare provider, as many medications, e.g. NSAIDs, decongestants, can worsen fluid retention, increase blood pressure, and exacerbate heart failure symptoms. 98. A sudden increase in heart failure symptoms, such as worsening dyspnea and orthopnea, should prompt immediate medical evaluation. True or false? Answer: true. Rationale: a sudden increase in heart failure symptoms, like worsening shortness of breath or orthopnea, may indicate acute decompensation. Prompt medical evaluation is crucial to adjust treatment and prevent further complications, such as pulmonary edema or cardiogenic shock. 99. Heart failure patients are generally advised to limit their physical activity to avoid further strain on the heart. True or false? Answer: false. Rationale: while excessive or strenuous physical activity should be avoided, regular moderate exercise is encouraged in heart failure patients to improve cardiovascular fitness, endurance, and overall well-being. Physical activity can help improve functional capacity and reduce hospitalizations. 100. In heart failure management, monitoring renal function is crucial when using medications like ACE inhibitors, ARBs, and diuretics. True or false? Answer: true. Rationale: medications like ACE inhibitors, ARBs, and diuretics can affect renal function. Monitoring renal function is crucial to prevent acute kidney injury, electrolyte imbalances, and ensure safe and effective treatment in heart failure patients. 101. The primary goal in treating heart failure is to prevent the need for a heart transplant. True or false? Answer: false. Rationale: the primary goal in treating heart failure is to manage symptoms, improve quality of life, and prevent disease progression. While heart transplantation is an option for end-stage heart failure, the focus of treatment is on long-term symptom management, medication, and lifestyle interventions. 102. Left-sided heart failure primarily leads to pulmonary congestion and shortness of breath. True or false? Answer: true. Rationale: left-sided heart failure leads to the backup of blood in the lungs, causing pulmonary congestion. This results in symptoms such as shortness of breath, orthopnea, and pulmonary edema, which are hallmark signs of left-sided heart failure. 103. In heart failure patients with severe symptoms, intravenous, vasodilators like nitroglycerin can be used to reduce afterload and improve cardiac output. True or false? Answer: true. Rationale: for vasodilators, such as nitroglycerin, are used in severe heart failure to reduce afterload, resistance, and improve cardiac output. This can help alleviate symptoms like dyspnea and pulmonary congestion, especially in acute settings. 104. Statins are routinely prescribed to all heart failure patients to lower cholesterol levels and reduce mortality.
True or false?
Answer: false. Rationale: statins are beneficial in managing cardiovascular risk factors like high cholesterol, but they are not routinely prescribed for all heart failure patients. Statins are generally reserved for patients with concurrent coronary artery disease or hyperlipidemia. 105. The use of intravenous diuretics is often necessary in hospitalized heart failure patients with acute volume overload to rapidly reduce fluid retention.
True or false?
Answer: true. Rationale: in hospitalized heart failure patients with acute volume overload, intravenous diuretics like furosemide are commonly used to rapidly remove excess fluid and relieve symptoms like pulmonary edema and peripheral edema. 106. In patients with heart failure, long-term use of anticoagulants is required to prevent blood clots and stroke risk.
True or false?
Answer: false. Rationale: anticoagulants are typically used in heart failure patients with atrial fibrillation or other conditions that increase the risk of blood clots and stroke. Not all heart failure patients require anticoagulants as a routine measure. 107. Heart failure patients should avoid all forms of alcohol, as it can exacerbate heart failure symptoms.
True or false?
Answer: false. Rationale: while excessive alcohol consumption should be avoided, moderate alcohol intake is not always contraindicated. However, alcohol can negatively affect heart function in some individuals, and the decision to drink should be made in consultation with the healthcare provider. 108. Renal function monitoring is particularly important in heart failure patients receiving treatment with ACE inhibitors, as these drugs can cause renal impairment.
True or false?
Answer: true. Rationale: ACE inhibitors can reduce glomerular filtration rate and lead to acute kidney injury, particularly in heart failure patients. Regular monitoring of renal function is essential to ensure safe use of these medications and avoid renal complications. 109. In heart failure patients, the use of digitalis digoxin can help improve symptoms of congestion and increase heart contractility.
True or false?
Answer: true. Rationale: digitalis digoxin is used in heart failure to increase the force of cardiac contraction, positive inotropic effect, and slow the heart rate. It can help improve symptoms like congestion and dyspnea, especially in patients with atrial fibrillation. 110. Heart failure patients with diabetes should aim for tight glycemic control, as uncontrolled blood sugar can worsen heart failure symptoms.
True or false?
Answer: true. Rationale: uncontrolled blood sugar in heart failure patients with diabetes can increase fluid retention, exacerbate hypertension, and promote cardiovascular damage. Tight glycemic control is essential for managing both conditions and improving overall outcomes. 111. High levels of circulating norepinephrine are beneficial in heart failure by improving cardiac output and blood pressure.
True or false?
Answer: false. Rationale: high levels of circulating norepinephrine are detrimental in heart failure as they increase heart rate, blood pressure, and myocardial oxygen demand, further worsening heart failure. Medications like beta blockers help counteract excessive sympathetic stimulation. 112. In heart failure, left-sided heart failure typically results in peripheral edema and abdominal bloating.
True or false?
Answer: false. Rationale: left-sided heart failure primarily causes pulmonary symptoms such as dyspnea, orthopnea, and pulmonary edema. Right-sided heart failure, which often results from left-sided failure, leads to peripheral edema, abdominal bloating, and ascites. 113. For patients with heart failure and chronic kidney disease, careful management of diuretics is essential to avoid worsening renal function.
True or false?
Answer: true. Rationale: diuretics can cause electrolyte imbalances and worsen kidney function, particularly in patients with chronic kidney disease. Careful monitoring of renal function and electrolyte levels is crucial to avoid complications and optimize heart failure management. 114. The primary benefit of using aldosterone antagonists, e.g., spironolactone, in heart failure is to reduce fluid retention by enhancing diuresis. True or false? Answer: false. Rationale: aldosterone antagonists like spironolactone are used in heart failure primarily to counteract the effects of aldosterone, which promotes sodium retention and fluid buildup. These medications help reduce fibrosis, improve survival, and lower hospitalizations, not just enhance diuresis. 115. Beta blockers should be started at high doses in heart failure patients to rapidly improve symptoms. True or false? Answer: false. Rationale: beta blockers should be started at low doses and gradually titrated up to avoid exacerbating heart failure symptoms. Rapid initiation at high doses can cause bradycardia, hypotension, and worsening heart failure. 116. Heart failure patients with severe symptoms should avoid being placed in a supine position to prevent worsened fluid retention. True or false? Answer: true. Rationale: placing heart failure patients in a supine position can exacerbate fluid retention in the lungs, pulmonary edema, and worsen symptoms like shortness of breath. Elevating the head of the bed or positioning patients upright can help alleviate these symptoms. 117. The use of nonsteroidal anti-inflammatory drugs, NSAIDs, should be avoided in heart failure patients, as they can lead to fluid retention and worsening of heart failure. True or false? Answer: true. Rationale: NSAIDs can cause sodium and water retention, raise blood pressure, and impair renal function, all of which can exacerbate heart failure symptoms. These medications should be avoided unless absolutely necessary and used with caution. 118. In heart failure patients, a daily step count or walking regimen is an important part of self-care and symptom management. True or false? Answer: true. Rationale: regular light exercise, such as walking, is beneficial for heart failure patients as it improves cardiovascular fitness, increases endurance, and helps reduce fatigue and dyspnea. A step count or walking regimen should be individualized based on the patient's tolerance. 119. End-stage heart failure patients are typically treated with aggressive drug therapy to prevent hospitalization.
True or false?
Answer: false. Rationale: in end-stage heart failure, the focus shifts to palliative care rather than aggressive drug therapy, as the condition is often refractory to treatment. The goal is to improve comfort, alleviate symptoms, and ensure quality of life, rather than prolong survival at all costs. 120. Heart failure patients with a history of ischemic heart disease are at higher risk for arrhythmias and sudden cardiac arrest. True or false? Answer: true. Rationale: ischemic heart disease, e.g., coronary artery disease, is a significant risk factor for arrhythmias and sudden cardiac arrest in heart failure patients. Damage to the heart's electrical conduction system increases the likelihood of these life-threatening events. 121. A patient with heart failure should be advised to avoid high-fiber foods to prevent bloating and discomfort. True or false? Answer: false. Rationale: a high-fiber diet is important for heart failure patients to prevent constipation, a common side effect of diuretic therapy. Fiber helps promote healthy digestion and regular bowel movements, which is essential for overall health in heart failure management. 122. Atrial fibrillation is a common arrhythmia seen in heart failure patients and may require rate control or rhythm correction. True or false? Answer: true. Rationale: atrial fibrillation is common in heart failure due to the structural and electrical remodeling of the heart. Rate control, e.g., with beta blockers or calcium channel blockers, and rhythm correction may be necessary to prevent thromboembolism, improve heart rate, and optimize cardiac function. 123. Heart failure patients with fluid retention may be prescribed potassium supplements to counteract hypokalemia caused by diuretics. True or false? Answer: true. Rationale: potassium supplements may be prescribed to prevent hypokalemia, a potential side effect of diuretics, especially loop diuretics. Low potassium levels can lead to arrhythmias and other complications, so maintaining an adequate potassium level is important in heart failure management. 124. Heart failure patients should be instructed to weigh themselves daily to detect early signs of fluid retention. True or false? Answer: true. Rationale: daily weight monitoring is an effective way for heart failure patients to detect early signs of fluid retention, which can indicate worsening heart failure. A sudden weight gain of 2 to 3 pounds in a day should be reported to a healthcare provider. 125. Heart failure patients with chronic anemia may benefit from erythropoiesis-stimulating agents, ESAs, to improve oxygen delivery to tissues.
True or false?
Answer: true. Rationale: chronic anemia is common in heart failure and can worsen symptoms by reducing oxygen delivery to tissues. Erythropoiesis-stimulating agents, ESAs, can be used to stimulate red blood cell production, improving oxygenation and potentially alleviating some heart failure symptoms. 126. In heart failure management, invasive monitoring tools like pulmonary artery catheters are used in the outpatient setting to assess treatment efficacy.
True or false?
Answer: false. Rationale: invasive monitoring tools, such as pulmonary artery catheters, are typically used in the inpatient setting to assess hemodynamics in acutely ill patients. In outpatient settings, non-invasive monitoring methods are preferred for managing chronic heart failure. 127. Patients with heart failure should be educated on the signs and symptoms of worsening heart failure, including increased fatigue and dyspnea.
True or false?
Answer: true. Rationale: education on the early signs and symptoms of worsening heart failure, such as increased fatigue, shortness of breath, and swelling, is essential for proactive management. This helps patients seek timely medical care to prevent hospitalization and complications. 128. Heart failure patients with hypertension should be started on antihypertensive therapy to control blood pressure and reduce the risk of heart failure progression.
True or false?
Answer: true. Rationale: controlling hypertension is critical in heart failure management, as high blood pressure can worsen the condition by increasing afterload and myocardial workload. Antihypertensive therapy, such as ACE inhibitors, ARBs, or beta blockers, is commonly prescribed to control blood pressure. 129. Iron supplementation is often recommended for heart failure patients with iron deficiency to improve exercise tolerance and reduce fatigue.
True or false?
Answer: true. Rationale: iron deficiency is common in heart failure and can worsen symptoms like fatigue and reduced exercise tolerance. Iron supplementation, either orally or intravenously, can help improve these symptoms and enhance overall function. 130. The use of corticosteroids in heart failure patients is beneficial for reducing inflammation and improving cardiac function.
True or false?
Answer: false. Rationale: corticosteroids are generally avoided in heart failure management because they can lead to fluid retention, hypertension, and hyperglycemia, which worsen heart failure. The risks often outweigh the benefits in heart failure patients. 131. A patient with heart failure should be educated to monitor for symptoms such as weight gain, shortness of breath, and swelling to assess fluid retention.
True or false?
Answer: true. Rationale: monitoring for symptoms such as weight gain, shortness of breath, and swelling is crucial for detecting early signs of fluid retention, which can indicate worsening heart failure. Early intervention can prevent hospitalization and further complications. 132. The use of angiotensin-converting enzyme inhibitors, ACE inhibitors, in heart failure is contraindicated in patients with hyperkalemia.
True or false?
Answer: true. Rationale: ACE inhibitors can increase potassium levels by inhibiting aldosterone, which may exacerbate hyperkalemia. These medications should be avoided in patients with pre-existing hyperkalemia or used cautiously with frequent monitoring. 133. In heart failure patients with chronic kidney disease, a diuretic regimen should be adjusted to prevent exacerbating renal dysfunction. True or false? Answer: true. Rationale: diuretics can exacerbate renal dysfunction in heart failure patients with chronic kidney disease. Renal function should be monitored closely, and diuretic doses should be adjusted to avoid further kidney damage while controlling fluid overload. 134. Low-dose aspirin is commonly prescribed to heart failure patients to reduce the risk of blood clots and stroke. True or false? Answer: false. Rationale: while aspirin may be used in patients with heart failure and coronary artery disease to reduce the risk of myocardial infarction or stroke, it is not routinely prescribed to all heart failure patients. Its use is typically reserved for those with a history of thrombosis or ischemic events. 135. Patients with heart failure should be advised to limit their alcohol intake to 1 or 2 drinks per day to avoid worsening heart failure. True or false? Answer: false. Rationale: alcohol should be avoided or consumed in very limited amounts, as it can contribute to fluid retention, arrhythmias, and exacerbate heart failure symptoms. Moderate to heavy drinking can also negatively impact heart function and treatment adherence. 136. Statins should be prescribed routinely to heart failure patients to reduce the risk of cardiovascular events, regardless of lipid levels. True or false? Answer: false. Rationale: statins are beneficial in patients with heart failure and concomitant coronary artery disease or hyperlipidemia, but they are not routinely prescribed to all heart failure patients. The decision to initiate statin therapy depends on individual risk factors. 137. The use of left ventricular assist devices, LVADs, is only for patients with advanced heart failure who are awaiting heart transplantation. True or false? Answer: false. Rationale: LVADs can be used in both bridge to transplantation and destination therapy, long-term support for patients who are not candidates for transplant. They are also used in patients with advanced heart failure who do not qualify for heart transplantation. 138. Heart failure patients with a low ejection fraction should be considered for an implantable cardioverter defibrillator, ICD, to prevent sudden cardiac death. True or false? Answer: true. Rationale: an ICD is recommended for heart failure patients with low ejection fractions, usually less than or equal to 35%, who are at risk for life-threatening arrhythmias. It delivers electrical shocks to restore normal rhythm in the event of a dangerous arrhythmia, preventing sudden cardiac death. 139. Is recommended to increase the sodium intake in heart failure patients to help improve fluid balance and blood pressure. True or false? Answer: false. Rationale: sodium intake should be restricted in heart failure patients to reduce fluid retention and prevent worsening symptoms like edema and hypertension. A low-sodium diet helps control blood pressure and decreases fluid buildup. 140. Patients with heart failure are typically instructed to limit their daily potassium intake to avoid hyperkalemia caused by diuretics. True or false? Answer: false. Rationale: potassium intake should be monitored and adjusted based on diuretic use. While potassium-sparing diuretics may increase potassium levels, patients on other diuretics like loop diuretics are at risk for hypokalemia, and potassium supplementation or dietary intake may be necessary. 141. Heart failure patients who experience episodes of fluid overload may be prescribed diuretics to reduce pulmonary edema and peripheral swelling. True or false? Answer: true. Rationale: diuretics are a first-line treatment for managing fluid overload in heart failure patients. They help reduce pulmonary edema and peripheral swelling by promoting the excretion of excess fluid, which alleviates symptoms such as shortness of breath and edema. 142. Anticoagulation therapy is a standard treatment for heart failure patients to prevent the formation of blood clots in the heart. True or false? Answer: false. Rationale: anticoagulation therapy is not routinely used in all heart failure patients. It is primarily indicated for patients with atrial fibrillation or those at high risk for thromboembolism. Routine anticoagulation is not recommended in the absence of these conditions. 143. In heart failure management, a reduced ejection fraction is a key indicator for initiating the use of beta blockers. True or false? Answer: true. Rationale: beta blockers are recommended for patients with heart failure and reduced ejection fraction, HFrEF, to improve survival, reduce hospitalizations, and alleviate symptoms. They help reduce the workload on the heart and prevent arrhythmias. 144. The primary goal in heart failure management is to cure the condition through medical or surgical interventions.
True or false?
Answer: false. Rationale: while interventions can improve symptoms, reduce hospitalizations, and extend life expectancy, heart failure is a chronic condition that cannot be cured. The primary goal is to manage symptoms, improve quality of life, and prevent disease progression. 145. Patients with heart failure should be educated on the importance of smoking cessation, as smoking can worsen heart function and increase the risk of complications. True or false?
Answer:
true. Rationale: smoking is a major risk factor for worsening heart failure as it increases the workload on the heart, promotes vasoconstriction, and impairs oxygen delivery. Smoking cessation is crucial for improving heart function and reducing the risk of complications. 146. In patients with heart failure, regular monitoring of weight and electrolytes is important to adjust fluid management and prevent complications.
True or false?
Answer: true. Rationale: monitoring weight daily helps detect early signs of fluid retention. Electrolyte levels, e.g., sodium, potassium, should also be monitored regularly, especially when diuretics are used, to prevent imbalances that can lead to arrhythmias or kidney dysfunction. 147. The use of an external defibrillator is appropriate for all heart failure patients who experience arrhythmias.
True or false?
Answer: false. Rationale: external defibrillators are typically used in emergency situations for patients experiencing life-threatening arrhythmias, not as a routine treatment for all heart failure patients. The use of ICDs or other arrhythmia therapies is based on individual patient risk factors. 148. For heart failure patients with a history of myocardial infarction, ACE inhibitors or ARBs are commonly prescribed to reduce the risk of remodeling and improve outcomes. True or false?
Answer:
true. Rationale: ACE inhibitors or ARBs are commonly prescribed in heart failure patients with a history of myocardial infarction. These drugs help prevent cardiac remodeling, reduce blood pressure, and decrease the risk of further heart damage, improving long-term outcomes. 149. Chronic use of non-potassium-sparing diuretics in heart failure patients may require potassium supplementation.
True or false?
Answer: true. Rationale: non-potassium-sparing diuretics, such as furosemide, can lead to hypokalemia due to the increased excretion of potassium. Potassium supplementation is often necessary to maintain normal potassium levels and prevent arrhythmias. 150. For patients with heart failure and atrial fibrillation, anticoagulant therapy is typically used to reduce the risk of stroke.
True or false?
Answer: true. Rationale: anticoagulation therapy, such as warfarin or direct oral anticoagulants, is commonly prescribed to heart failure patients with atrial fibrillation to reduce the risk of thromboembolic events, including stroke. 151. Physical therapy should be a part of the treatment plan for heart failure patients to improve mobility and overall physical function.
True or false?
Answer: true. Rationale: physical therapy is an important part of heart failure management. It helps improve mobility, reduces fatigue, and enhances overall functional capacity, which is essential for quality of life in heart failure patients. 152. Heart failure patients should avoid engaging in any form of exercise to prevent additional strain on the heart.
True or false?
Answer: false. Rationale: while excessive exercise should be avoided, regular moderate-intensity exercise is encouraged in heart failure patients as it improves cardiovascular function, reduces symptoms, and enhances quality of life. Exercise regimens should be individualized. 153. A heart failure patient with a blood pressure of 140/90 mmHg or higher may require antihypertensive therapy to reduce the risk of further cardiac damage.
True or false?
Answer: true. Rationale: elevated blood pressure can increase the workload on the heart and worsen heart failure. Antihypertensive therapy is essential to control blood pressure and reduce the risk of further cardiac damage and progression of heart failure. 154. An important aspect of heart failure patient care is teaching the patient to recognize and manage potential triggers of fluid retention, such as excessive salt intake or missed doses of diuretics.
True or false?
Answer: true. Rationale: educating patients about managing triggers like excess salt intake or missed medications is critical for preventing fluid retention, which can worsen heart failure symptoms. Proper adherence to medications and lifestyle modifications can significantly improve outcomes. 155. A heart failure patient with a history of depression should be regularly assessed for mental health concerns, as depression can negatively affect heart failure management and quality of life.
True or false?
Answer: true. Rationale: depression is common in heart failure patients and can lead to poor medication adherence, decreased physical activity, and worsening symptoms. Regular screening for depression and providing appropriate mental health support can improve overall heart failure management and patient outcomes. 156. Heart failure patients with moderate symptoms should avoid any form of physical activity to prevent further strain on the heart. True or false? Answer: false. Rationale: while intense exercise should be avoided, regular moderate activity, such as walking or low-impact exercises, can improve functional capacity and reduce heart failure symptoms. It is essential to tailor exercise regimens based on individual tolerance. 157. In patients with heart failure, dehydration is a common concern and may lead to kidney dysfunction, particularly when using diuretics. True or false? Answer: true. Rationale: dehydration can occur due to excessive use of diuretics, leading to reduced kidney perfusion and potential renal dysfunction. It is critical to monitor fluid status, electrolyte levels, and kidney function regularly to prevent these complications. 158. The use of a biventricular pacemaker is recommended for heart failure patients with both reduced ejection fraction and conduction abnormalities. True or false? Answer: true. Rationale: a biventricular pacemaker, also known as cardiac resynchronization therapy (CRT), is indicated for patients with heart failure and conduction abnormalities, e.g., bundle branch block, to improve ventricular synchronization, enhance cardiac output, and reduce symptoms. 159. Heart failure patients with a history of angina should be prescribed nitroglycerin as a first-line treatment to relieve chest pain.
True or false?
Answer: true. Rationale: nitroglycerin is used to relieve chest pain and reduce myocardial oxygen demand by dilating coronary vessels. It is often prescribed in heart failure patients with angina to improve symptoms and reduce the risk of further ischemic events. 160. In heart failure patients, fluid intake should be restricted to 1 to 1.5 liters per day to prevent fluid overload.
True or false?
Answer: true. Rationale: fluid restriction is often recommended in heart failure patients, especially those with significant edema or pulmonary congestion, to prevent fluid overload. The exact amount of fluid restriction is individualized based on the severity of the condition and other clinical factors. 161. A patient with heart failure and reduced ejection fraction, HFrEF, is likely to benefit from the addition of an angiotensin receptor neprilysin inhibitor, ARNI, to their treatment regimen.
True or false?
Answer: true. Rationale: angiotensin receptor neprilysin inhibitors, ARNIs, such as sacubitril/valsartan, are recommended for heart failure patients with reduced ejection fraction. They help reduce mortality, hospitalizations, and symptoms by promoting vasodilation, reducing neurohormonal activation, and preventing fluid retention. 162. For patients with heart failure, weight loss is typically encouraged to decrease the strain on the heart and improve symptoms. True or false? Answer: false. Rationale: while weight loss is important for overweight or obese heart failure patients to reduce cardiac strain, the focus should be on managing fluid retention rather than focusing solely on weight loss. Patients with heart failure should prioritize a balanced diet and fluid management. 163. A low-fat diet is recommended for heart failure patients to reduce the risk of further cardiovascular events. True or false? Answer: true. Rationale: a low-fat diet, particularly one low in saturated and trans fats, helps reduce the risk of atherosclerosis and further cardiovascular events in heart failure patients. This diet supports heart health and reduces the strain on the cardiovascular system. 164. Heart failure patients should be encouraged to use compression stockings to prevent the development of deep vein thrombosis, DVT.
True or false?
Answer: true. Rationale: compression stockings can help prevent deep vein thrombosis, DVT, in heart failure patients who are at higher risk due to reduced mobility and fluid retention. They help improve venous return and reduce swelling in the legs. 165. Patients with heart failure should be educated about the importance of monitoring their blood pressure regularly, as uncontrolled hypertension can exacerbate heart failure.
True or false?
Answer: true. Rationale: monitoring blood pressure is essential for heart failure patients. Uncontrolled hypertension increases the workload on the heart, exacerbating symptoms and promoting further heart damage. Maintaining blood pressure within target ranges helps prevent disease progression. 166. The use of anticoagulation therapy is essential for all heart failure patients to reduce the risk of thromboembolism.
True or false?
Answer: false. Rationale: anticoagulation therapy is not routinely prescribed for all heart failure patients. It is primarily used in those with atrial fibrillation, previous thromboembolic events, or other conditions that increase the risk of clot formation. 167. Heart failure patients with a history of hypertension should be treated with diuretics to reduce afterload and improve heart function. True or false? Answer: false. Rationale: diuretics are used in heart failure primarily to reduce fluid retention and alleviate symptoms such as edema and pulmonary congestion. They do not directly reduce afterload. Blood pressure control in hypertensive heart failure patients is typically achieved with antihypertensives like ACE inhibitors or beta blockers. 168. Heart failure patients should avoid taking herbal supplements like ginseng, as they can interfere with prescribed medications and worsen symptoms.
True or false?
Answer: true. Rationale: herbal supplements like ginseng can interact with medications such as beta blockers, diuretics, or anticoagulants, potentially causing side effects or diminishing their effectiveness. Patients with heart failure should consult healthcare providers before taking any supplements. 169. End-stage heart failure patients are typically candidates for heart transplantation if they meet specific criteria.
True or false?
Answer: true. Rationale: heart transplantation is a treatment option for end-stage heart failure patients who meet criteria such as severe symptoms despite optimal medical therapy, absence of contraindications, and acceptable organ availability. It offers the best chance for survival in select patients. 170. Heart failure patients with a history of alcohol abuse should be encouraged to reduce alcohol consumption gradually.
True or false?
Answer: true. Rationale: alcohol can exacerbate heart failure symptoms by causing fluid retention, arrhythmias, and direct myocardial damage. Patients with a history of alcohol abuse should be educated on the importance of reducing or completely eliminating alcohol intake to improve heart function and overall health. 171. The goal of pharmacologic treatment for heart failure is to improve heart muscle contractility and reduce excessive sympathetic nervous system activation.
True or false?
Answer: true. Rationale: the goal of pharmacologic therapy in heart failure is to reduce symptoms, improve heart function, and prevent disease progression. Medications like ACE inhibitors, beta blockers, and digoxin help improve cardiac contractility, reduce the workload on the heart, and counteract harmful neurohormonal activation. 172. Heart failure patients with advanced symptoms may benefit from the use of intravenous inotropes, such as dobutamine, to improve heart function.
True or false?
Answer: true. Rationale: intravenous inotropes like dobutamine are used in acute heart failure to improve cardiac output by increasing myocardial contractility. They are typically used in short-term, severe cases to stabilize patients before other interventions, such as mechanical support or transplantation. 173. For patients with heart failure, fluid resuscitation with intravenous fluids is often necessary to increase cardiac output in cases of hypovolemia.
True or false?
Answer: false. Rationale: in heart failure, fluid overload is a concern rather than hypovolemia. Intravenous fluids are not typically used unless the patient is in hypovolemic shock or dehydration. Fluid balance must be carefully managed to avoid exacerbating heart failure symptoms. 174. The use of mechanical circulatory support, such as a left ventricular assist device, LVAD, is a viable option for heart failure patients who are not candidates for heart transplantation. True or false? Answer: true. Rationale: LVADs are used as a long-term support option for heart failure patients who are not eligible for heart transplantation. They can improve symptoms and quality of life, and in some cases, they are used as destination therapy for patients with no other viable treatment options. 175. Heart failure patients should be monitored for signs of depression, as mental health can significantly affect treatment adherence and overall outcomes.
True or false?
Answer: true. Rationale: depression is common in heart failure patients and can negatively impact treatment adherence, physical activity, and overall health. Routine screening for depression and providing mental health support can improve outcomes and enhance quality of life. 176. A diet high in potassium is recommended for heart failure patients who are on potassium-sparing diuretics. True or false? Answer: true. Rationale: potassium-sparing diuretics, such as spironolactone, can raise potassium levels. Therefore, heart failure patients taking these diuretics may benefit from a potassium-rich diet to maintain normal potassium levels and avoid hypokalemia, although excessive potassium intake should also be avoided. 177. Beta blockers can be used in heart failure to decrease heart rate and blood pressure, thereby reducing the heart's oxygen demand. True or false? Answer: true. Rationale: beta blockers are essential in heart failure management as they reduce heart rate, blood pressure, and myocardial oxygen demand. This helps improve symptoms, reduce hospitalizations, and improve survival in patients with heart failure. 178. The administration of digoxin in heart failure patients improves mortality rates significantly. True or false? Answer: false. Rationale: while digoxin can improve symptoms and reduce hospitalizations by enhancing myocardial contractility, it does not significantly impact mortality rates in heart failure patients. Its use is typically reserved for patients with atrial fibrillation or those who remain symptomatic despite other treatments. 179. Patients with heart failure should limit their intake of processed foods, as they are often high in sodium and can exacerbate fluid retention.
True or false?
Answer: true. Rationale: processed foods are typically high in sodium, which can exacerbate fluid retention and worsen heart failure symptoms. A low-sodium diet is essential for controlling edema, blood pressure, and overall heart function. 180. Monitoring of serum calcium levels is unnecessary in heart failure patients on standard pharmacologic therapy. True or false? Answer: false. Rationale: monitoring calcium levels is important, especially in patients on diuretics or other medications that can affect electrolyte balance. Both hypercalcemia and hypocalcemia can lead to arrhythmias, which may worsen heart failure. Regular monitoring of electrolytes, including calcium, is essential for patient safety. 181. Heart failure patients who experience significant fatigue should be encouraged to increase physical activity to improve their stamina. True or false? Answer: true. Rationale: gradual and tailored physical activity is beneficial for heart failure patients experiencing fatigue. It improves exercise tolerance, strengthens the heart, and enhances overall quality of life, but the intensity should be adjusted based on the patient's condition. 182. Fluid retention is often treated with loop diuretics, which are effective in removing excess fluid from the body in heart failure patients. True or false? Answer: true. Rationale: loop diuretics like furosemide are commonly used in heart failure patients to reduce fluid overload by increasing urine production, which alleviates symptoms like edema and pulmonary congestion. 183. Statin therapy is routinely recommended for all heart failure patients to reduce cholesterol and improve outcomes. True or false? Answer: false. Rationale: statins are generally recommended for heart failure patients with concomitant hyperlipidemia or coronary artery disease, but they are not routinely prescribed for all heart failure patients. The decision is based on individual cardiovascular risk factors. 184. ACE inhibitors like enalapril are used in heart failure to reduce the workload on the heart by decreasing systemic vascular resistance. True or false? Answer: true. Rationale: ACE inhibitors help lower blood pressure and reduce afterload, making it easier for the heart to pump blood. This improves symptoms and outcomes in heart failure patients by reducing the strain on the heart. 185. In patients with heart failure, beta blockers are contraindicated because they lower heart rate and may worsen heart failure symptoms. True or false? Answer: false. Rationale: beta blockers are a cornerstone of heart failure management as they reduce heart rate, decrease myocardial oxygen demand, and help prevent arrhythmias. They improve survival and reduce hospitalizations in heart failure patients, especially those with reduced ejection fraction. 186. Antiplatelet therapy with medications like aspirin is recommended for all heart failure patients to reduce the risk of thromboembolism. True or false? Answer: false. Rationale: antiplatelet therapy is typically reserved for heart failure patients who have coronary artery disease, a history of myocardial infarction, or other conditions that increase the risk of thrombosis. Not all heart failure patients need aspirin or other antiplatelet drugs. 187. Heart failure patients should be encouraged to monitor their daily weight to detect fluid retention early. True or false? Answer: true. Rationale: daily weight monitoring is critical in heart failure management. Rapid weight gain, e.g., 2 to 3 pounds in a day, can signal fluid retention, which is an early sign of worsening heart failure and should prompt intervention. 188. Heart failure patients should be encouraged to use a low-potassium diet to avoid hyperkalemia while taking diuretics. True or false? Answer: false. Rationale: while potassium levels should be monitored, most heart failure patients on diuretics are at risk for hypokalemia, low potassium, particularly if they're on non-potassium-sparing diuretics. A low-potassium diet may be necessary in some cases, but supplementation is often needed to maintain normal potassium levels. 189. The use of digoxin in heart failure patients is primarily to increase heart rate and improve symptoms of fatigue. True or false? Answer: false. Rationale: digoxin is used to improve myocardial contractility, not heart rate. It helps the heart pump more efficiently and can alleviate symptoms like fatigue and dyspnea in patients with heart failure. However, it should be used cautiously due to potential toxicity. 190. Heart failure patients who experience frequent episodes of shortness of breath should be given oxygen therapy to alleviate symptoms. True or false? Answer: true. Rationale: oxygen therapy is often used in heart failure patients with hypoxemia or severe shortness of breath, particularly if they have pulmonary congestion. It improves oxygen delivery to tissues and can reduce symptoms like dyspnea. 191. Patients with heart failure should avoid nonsteroidal anti-inflammatory drugs, NSAIDs, as they can increase the risk of fluid retention and worsen heart failure symptoms.
True or false?
Answer: true. Rationale: NSAIDs can cause sodium and water retention, reduce kidney function, and increase blood pressure, all of which can exacerbate heart failure symptoms. Alternative pain management strategies should be considered. 192. For heart failure patients, it is important to monitor serum creatinine levels regularly to assess kidney function, especially when using diuretics. True or false? Answer: true. Rationale: diuretics can affect renal function by reducing renal perfusion, and it is essential to monitor serum creatinine to detect any signs of kidney dysfunction or worsening renal failure. 193. A heart failure patient with a left ventricular ejection fraction of less than 35% should not be prescribed a beta blocker. True or false? Answer: false. Rationale: beta blockers are recommended for patients with heart failure and a reduced ejection fraction, less than or equal to 35%, to improve survival, reduce hospitalizations, and improve overall heart function. 194. Diuretic therapy in heart failure patients can lead to dehydration, and fluid balance should be monitored carefully. True or false? Answer: true. Rationale: diuretics can lead to excessive fluid loss and dehydration, especially in high doses. Careful monitoring of fluid intake and output, as well as electrolyte levels, is crucial to prevent complications like hypotension and kidney dysfunction. 195. All heart failure patients should undergo regular echocardiograms to assess cardiac function and guide treatment decisions. True or false? Answer: true. Rationale: regular echocardiograms help assess left ventricular ejection fraction and other indicators of heart function. This information is essential for guiding treatment decisions, including the use of ACE inhibitors, beta blockers, and other therapies. 196. For heart failure patients with a history of diabetes, controlling blood sugar levels is important to prevent exacerbations of heart failure symptoms. True or false? Answer: true. Rationale: poorly controlled diabetes can worsen heart failure by increasing blood pressure, promoting vascular damage, and contributing to fluid retention. Tight glycemic control helps manage symptoms and reduce cardiovascular complications in these patients. 197. Heart failure patients with comorbid hypertension should be managed with antihypertensive therapy to reduce the afterload and improve cardiac output.
True or false?
Answer: true. Rationale: proper management of hypertension is crucial in heart failure. Antihypertensive medications, such as ACE inhibitors, ARBs, or beta blockers, help reduce afterload, improve myocardial perfusion, and decrease the heart's workload, improving patient outcomes. 198. The administration of intravenous nitrates is used to reduce preload in heart failure patients with pulmonary edema.
True or false?
Answer: true. Rationale: intravenous nitrates are used in acute heart failure with pulmonary edema to reduce preload, venous return, which decreases the workload on the heart and helps alleviate symptoms of dyspnea and pulmonary congestion. 199. Sodium restriction is an essential component of managing heart failure, as excessive sodium intake can exacerbate fluid retention and worsen symptoms.
True or false?
Answer: true. Rationale: a low-sodium diet is critical in heart failure management. Sodium promotes water retention, which can worsen edema and increase blood pressure. Reducing sodium intake helps prevent fluid overload and improves symptom control. 200. Heart failure patients should be advised to eat small, frequent meals to avoid overloading the digestive system and exacerbating symptoms. True or false? Answer: true. Rationale: small, frequent meals reduce the risk of bloating, indigestion, and discomfort, which can exacerbate heart failure symptoms like shortness of breath. Large meals can also lead to increased venous return and worsen fluid retention. 201. Patients with heart failure and atrial fibrillation are usually prescribed anticoagulants to reduce the risk of thromboembolic events, including stroke. True or false? Answer: true. Rationale: anticoagulation therapy is important in heart failure patients with atrial fibrillation to reduce the risk of stroke and other thromboembolic events. This is typically achieved with medications like warfarin or direct oral anticoagulants. 202. In patients with heart failure, oxygen therapy should be discontinued once the oxygen saturation reaches above 95%. True or false? Answer: false. Rationale: oxygen therapy should be continued in heart failure patients with persistent hypoxemia, oxygen saturation below 90%, despite improvement. Discontinuing oxygen prematurely can worsen symptoms and lead to hypoxia. 203. Angiotensin receptor blockers, ARBs, are effective in heart failure patients who cannot tolerate ACE inhibitors due to side effects like cough. True or false? Answer: true. Rationale: ARBs are often used as an alternative to ACE inhibitors in heart failure patients who experience side effects like persistent cough. ARBs have a similar effect in reducing afterload and preventing fluid retention but are better tolerated by some patients. 204. The use of spironolactone, a potassium-sparing diuretic, in heart failure patients can reduce mortality and hospitalizations.
True or false?
Answer: true. Rationale: spironolactone, an aldosterone antagonist, has been shown to reduce mortality and hospitalizations in heart failure patients by counteracting aldosterone's harmful effects, such as fluid retention, fibrosis, and potassium loss. 205. A heart failure patient with severe symptoms should undergo mechanical ventilation if they are unable to maintain adequate oxygen saturation. True or false? Answer: true. Rationale: in cases of severe heart failure with respiratory distress or hypoxemia, mechanical ventilation may be necessary to maintain oxygen levels, reduce the work of breathing, and improve ventilation perfusion matching. 206. Heart failure patients who develop acute decompensated heart failure, ADHF, may benefit from the use of intravenous vasodilators to reduce preload and afterload. True or false? Answer: true. Rationale: intravenous vasodilators like nitroprusside or nitroglycerin can be used in acute decompensated heart failure, ADHF, to reduce preload and afterload, thereby decreasing the workload of the heart and improving symptoms such as pulmonary edema. 207. For heart failure patients, strict fluid restrictions are required in all cases to prevent exacerbation of symptoms. True or false? Answer: false. Rationale: fluid restrictions are typically implemented in patients with significant fluid retention or worsening symptoms. However, not all heart failure patients require strict fluid restrictions, as it depends on the individual's clinical condition and the extent of fluid overload. 208. The use of angiotensin receptor neprilysin inhibitors, ARNIs, has been shown to improve outcomes in heart failure with reduced ejection fraction, HFrEF. True or false? Answer: true. Rationale: ARNIs, such as sacubitril/valsartan, have been shown to improve survival, reduce hospitalizations, and decrease symptoms in patients with HFrEF. These drugs combine the benefits of both angiotensin receptor blockers and neprilysin inhibition to enhance heart function. 209. Heart failure patients with reduced ejection fraction, HFrEF, should avoid taking calcium channel blockers, as they can worsen heart failure. True or false? Answer: true. Rationale: calcium channel blockers, particularly non-dihydropyridine types, e.g., verapamil, diltiazem, are generally avoided in HFrEF patients, as they can depress myocardial contractility and worsen heart failure symptoms. 210. In heart failure, the use of a left ventricular assist device, LVAD, is typically limited to patients who are awaiting heart transplantation or are not candidates for a transplant. True or false? Answer: true. Rationale: LVADs are used as a bridge to heart transplantation for eligible candidates or as destination therapy for patients who are not candidates for a transplant, improving survival and quality of life in severe heart failure cases. 211. Heart failure patients with persistent hypertension should be prescribed nitrates to manage their high blood pressure. True or false? Answer: false. Rationale: nitrates are used in heart failure primarily to reduce preload and treat pulmonary congestion, not for hypertension management. Antihypertensive medications like ACE inhibitors, ARBs, beta blockers, and calcium channel blockers are typically used for blood pressure control in heart failure patients. 212. Heart failure patients should be monitored regularly for changes in mental status, as fluid overload can lead to confusion and altered consciousness. True or false? Answer: true. Rationale: fluid overload in heart failure can lead to cerebral hypoperfusion and electrolyte imbalances, contributing to confusion or altered mental status. Monitoring for neurological changes is important to assess for worsening heart failure or complications like hyponatremia. 213. In heart failure management, anticoagulation therapy is recommended for all patients with reduced ejection fraction to prevent clot formation. True or false? Answer: false. Rationale: anticoagulation is generally reserved for heart failure patients with specific indications, such as atrial fibrillation or a history of thromboembolic events. Not all patients with reduced ejection fraction require anticoagulants. 214. An important goal in the management of heart failure is to reduce the preload, which can be achieved through the use of diuretics and nitrates.
True or false?
Answer: true. Rationale: reducing preload is essential in managing heart failure, especially in cases of fluid overload. Diuretics help reduce excess fluid, while nitrates help by dilating veins and reducing venous return, both decreasing the heart's workload and improving symptoms. 215. Heart failure patients should be advised to avoid any form of alcohol consumption, as it can exacerbate heart failure symptoms.
True or false?
Answer: true. Rationale: alcohol can worsen heart failure by increasing fluid retention, promoting arrhythmias, and directly impairing cardiac function. Patients are advised to limit or eliminate alcohol intake to improve heart failure outcomes. 216. For heart failure patients with both heart failure and diabetes, medications like SGLT2 inhibitors have shown promise in improving both cardiac and renal outcomes. True or false? Answer: true. Rationale: SGLT2 inhibitors, such as empagliflozin and dapagliflozin, have been shown to improve both heart failure outcomes and renal function in patients with diabetes. These medications reduce hospitalization for heart failure and provide cardiovascular and renal protection. 217. It is important for heart failure patients to avoid excessive physical activity, as it can lead to increased strain on the heart and worsen symptoms. True or false? Answer: false. Rationale: while intense exercise should be avoided, moderate physical activity tailored to the patient's ability is encouraged to improve cardiovascular health, increase stamina, and reduce symptoms of heart failure. Regular exercise can enhance functional capacity and quality of life. 218. Patients with heart failure who are overweight or obese should follow a calorie-restricted diet to help reduce excess weight and improve heart function.
True or false?
Answer: true. Rationale: reducing excess weight in overweight or obese heart failure patients helps decrease the heart's workload, improve symptoms, and reduce the risk of further cardiovascular complications. A calorie-controlled diet and physical activity plan are important components of heart failure management. 219. The primary goal of pharmacologic treatment for heart failure is to increase the heart's contractility and improve ejection fraction. True or false? Answer: false. Rationale: while increasing heart contractility is important, the primary goals of pharmacologic therapy in heart failure include reducing symptoms, improving quality of life, preventing hospitalizations, and reducing mortality. Medications like ACE inhibitors, beta blockers, and diuretics play a key role in achieving these goals. 220. Regular follow-up visits are essential in heart failure management to monitor for symptom changes, medication adjustments, and potential complications.
True or false?
Answer: true. Rationale: frequent follow-up visits are essential to monitor disease progression, assess treatment efficacy, and address any complications. Regular visits help optimize therapy, prevent hospitalizations, and provide ongoing patient education and support. 221. The use of hydralazine and nitrates is particularly effective in African American heart failure patients to improve survival and reduce hospitalization rates.
True or false?
Answer: true. Rationale: hydralazine and nitrates have been shown to provide survival benefits and reduce hospitalization in African American heart failure patients, particularly those with HFrEF. This combination therapy is recommended for patients who are symptomatic despite the use of ACE inhibitors or ARBs. 222. A low-protein diet is recommended for heart failure patients to reduce kidney strain and improve outcomes. True or false? Answer: false. Rationale: a low-protein diet is not typically recommended for heart failure patients unless there is concurrent kidney disease, e.g., chronic kidney disease. Protein is essential for maintaining muscle mass and overall health, so a balanced diet with adequate protein intake is important in most heart failure patients. 223. Heart failure patients with a history of atrial fibrillation should be regularly monitored for the development of thromboembolism, especially if anticoagulation therapy is not used.
True or false?
Answer: true. Rationale: atrial fibrillation increases the risk of thromboembolic events such as stroke. Patients with heart failure and atrial fibrillation should be monitored closely for signs of clot formation, and anticoagulation therapy may be necessary to reduce the risk of stroke and other thromboembolic complications. 224. The use of corticosteroids in heart failure is typically discouraged as it can cause fluid retention and worsen symptoms.
True or false?
Answer: true. Rationale: corticosteroids can cause fluid retention, increase blood pressure, and exacerbate heart failure symptoms. They are generally avoided unless absolutely necessary, and alternative treatments with fewer side effects should be considered. 225. Continuous positive airway pressure, CPAP. Therapy can be beneficial for heart failure patients with obstructive sleep apnea as it improves oxygenation and reduces cardiovascular strain.
True or false?
Answer: true. Rationale: CPAP therapy is helpful for heart failure patients with obstructive sleep apnea by improving oxygen saturation during sleep, reducing the risk of hypoxemia, and decreasing cardiovascular strain. This can improve heart function and quality of life. 226. In heart failure management, exercise rehabilitation programs should be individualized, taking into account the patient's functional capacity and comorbid conditions. True or false? Answer: true. Rationale: exercise rehabilitation programs should be tailored to each patient to ensure that exercise intensity and duration are appropriate for their level of fitness, heart failure severity, and other comorbid conditions. Gradual increases in activity can improve cardiovascular health and overall well-being. 227. Patients with heart failure who have a high risk of arrhythmias may benefit from the placement of an implantable cardioverter defibrillator, ICD.
True or false?
Answer: true. Rationale: an ICD is indicated for heart failure patients at high risk of life-threatening arrhythmias, such as ventricular fibrillation or ventricular tachycardia. The device can detect and correct these arrhythmias, reducing the risk of sudden cardiac death. 228. When using ACE inhibitors in heart failure patients, the risk of hyperkalemia should be monitored, particularly if the patient is also taking potassium-sparing diuretics.
True or false?
Answer: true. Rationale: ACE inhibitors can increase potassium levels, and when combined with potassium-sparing diuretics, e.g., spironolactone, the risk of hyperkalemia increases. Regular monitoring of potassium levels is essential to prevent serious complications such as arrhythmias. 229. Heart failure patients with severe fluid retention may require dialysis if diuretics fail to control symptoms.
True or false?
Answer: true. Rationale: in cases of severe fluid retention that are unresponsive to diuretics, dialysis may be necessary to remove excess fluid, especially if kidney function is impaired. This is often considered in cases of acute decompensated heart failure with renal dysfunction. 230. Clinical guidelines recommend the use of beta blockers in heart failure patients even if they do not have a history of arrhythmias. True or false? Answer: true. Rationale: beta blockers are recommended for all heart failure patients with reduced ejection fraction, regardless of the presence of arrhythmias. They help reduce heart rate, prevent remodeling, and improve survival by decreasing myocardial oxygen demand and reducing the risk of arrhythmias. 231. Heart failure patients with concurrent chronic obstructive pulmonary disease, COPD, should avoid all forms of physical activity to prevent exacerbation of symptoms.
True or false?
Answer: false. Rationale: while both heart failure and COPD require careful management, patients are often encouraged to engage in mild to moderate physical activity to improve overall fitness and lung function. A tailored exercise program can help improve exercise tolerance and reduce symptoms of both conditions. 232. The primary goal of managing heart failure with reduced ejection fraction, HFrEF, is to reduce hospitalizations and improve long-term survival.
True or false?
Answer: true. Rationale: the main goals in managing HFrEF are to reduce hospitalizations, improve quality of life, and increase long-term survival. Medications such as ACE inhibitors, beta blockers, and mineralocorticoid receptor antagonists, MRAs, are key to achieving these outcomes. 233. Heart failure patients should limit their intake of dairy products to reduce fluid retention and improve heart function.
True or false?
Answer: false. Rationale: dairy products are not typically restricted for heart failure patients unless they have specific allergies or a lactose intolerance. The primary dietary modification in heart failure is a low-sodium diet to reduce fluid retention, not necessarily a restriction of dairy products. 234. In patients with heart failure, the use of aldosterone antagonists like spironolactone can help prevent potassium loss and improve symptoms.
True or false?
Answer: true. Rationale: Aldosterone antagonists like spironolactone help to prevent potassium loss by blocking aldosterone, a hormone that causes sodium retention and potassium excretion. This can help reduce fluid retention and improve heart failure symptoms, while also lowering the risk of arrhythmias due to hypokalemia. 235. The goal of using positive inotropic agents, such as dobutamine, in heart failure patients is to decrease the force of contraction of the heart. True or false? Answer: false. Rationale: positive inotropic agents like dobutamine increase the force of contraction of the heart, which is beneficial in patients with severe heart failure and low cardiac output. They are used to improve perfusion and alleviate symptoms of severe heart failure, not to decrease the heart's contractility. 236. Heart failure patients with severe symptoms should be placed on a low-fat diet to prevent further cardiac strain. True or false? Answer: false. Rationale: while a balanced diet that supports heart health is important, a specific low-fat diet is not universally recommended for heart failure patients unless they have comorbid conditions like hyperlipidemia. The main focus is on low-sodium and calorie-controlled diets to manage fluid balance and weight. 237. End-of-life care discussions should be part of the care plan for advanced heart failure patients to help prepare for palliative care options. True or false? Answer: true. Rationale: for advanced heart failure patients, end-of-life care discussions are important to ensure that their wishes are respected and that they receive appropriate palliative care. These discussions can help guide treatment decisions, especially when heart failure becomes refractory to standard therapies. 238. Patients with heart failure and a history of myocardial infarction should be prescribed aspirin for secondary prevention of cardiovascular events. True or false? Answer: true. Rationale: aspirin is commonly prescribed to heart failure patients who have a history of myocardial infarction to reduce the risk of further cardiovascular events, including stroke and another heart attack, by preventing platelet aggregation and thrombus formation. 239. When using diuretics in heart failure patients, the goal is to induce a state of dehydration to rapidly reduce fluid overload. True or false? Answer: false. Rationale: the goal of diuretic therapy is not to induce dehydration but to achieve a balance of fluid removal while maintaining electrolyte and volume balance. Overdiuresis can lead to dehydration, electrolyte imbalances, and renal dysfunction, so fluid removal should be gradual and monitored. 240. Heart failure patients who experience significant shortness of breath should be managed with supplemental oxygen therapy to improve oxygenation. True or false? Answer: true. Rationale: oxygen therapy is commonly used in heart failure patients who experience significant dyspnea or hypoxemia, especially when there is pulmonary congestion. It helps improve oxygenation and can reduce symptoms of breathlessness, providing symptomatic relief. 241. In heart failure management, dietary supplements such as omega-3 fatty acids are recommended to reduce inflammation and improve heart function. True or false? Answer: true. Rationale: omega-3 fatty acids have been shown to reduce inflammation and improve cardiovascular outcomes in heart failure patients. They can help reduce the risk of arrhythmias, improve myocardial function, and reduce mortality, although they should be used as part of a comprehensive treatment plan. 242. Heart failure patients should avoid all forms of stress, as it can significantly worsen heart failure symptoms. True or false? Answer: false. Rationale: while stress management is important for heart failure patients, it is unrealistic to avoid all forms of stress. Patients should be educated on stress reduction techniques such as relaxation exercises, mindfulness, and coping strategies to help minimize the impact of stress on heart health. 243. In severe heart failure, the use of an implantable cardioverter-defibrillator, ICD, is beneficial for preventing sudden cardiac death due to arrhythmias. True or false? Answer: true. Rationale: an ICD is indicated for heart failure patients at high risk of sudden cardiac death due to arrhythmias. It monitors heart rhythms and delivers shocks if life-threatening arrhythmias like ventricular tachycardia or ventricular fibrillation occur. 244. When treating heart failure, a combination of an ACE inhibitor and an angiotensin II receptor blocker, ARB, is recommended for all patients to optimize outcomes. True or false? Answer: false. Rationale: a combination of ACE inhibitors and ARBs is generally not recommended for all heart failure patients due to the increased risk of hyperkalemia, hypotension, and renal dysfunction. Typically, one class of these medications is used depending on patient tolerance and other factors. 245. Heart failure patients should be educated about the importance of monitoring their blood pressure regularly to prevent exacerbations of heart failure.
True or false?
Answer: true. Rationale: regular blood pressure monitoring is essential for heart failure patients. High blood pressure can increase the workload of the heart and exacerbate symptoms. Control of blood pressure through medications like ACE inhibitors or beta blockers can help improve heart function and reduce symptoms. 246. A heart failure patient with severe fluid retention should be given low-dose aspirin to help relieve edema.
True or false?
Answer: false. Rationale: low-dose aspirin is not indicated for fluid retention in heart failure. Aspirin is used for preventing thrombotic events, but fluid retention in heart failure is best managed with diuretics and other heart failure medications, such as ACE inhibitors or beta blockers. 247. Prophylactic antibiotics are routinely recommended for all heart failure patients to prevent infections. True or false? Answer: false. Rationale: prophylactic antibiotics are not routinely given to heart failure patients unless they have specific risk factors, such as the presence of endocarditis or an implanted device like an ICD. The use of antibiotics should be targeted based on specific clinical indications. 248. Sodium and fluid restriction are recommended for heart failure patients with significant edema to prevent further fluid retention. True or false? Answer: true. Rationale: sodium and fluid restrictions are commonly recommended for heart failure patients with significant edema or fluid retention. Reducing sodium intake helps prevent further fluid buildup, while fluid restrictions limit the volume of fluid that the heart must pump, helping to control symptoms. 249. In heart failure management, the use of aldosterone antagonists such as spironolactone has been shown to improve both survival and renal function.
True or false?
Answer: true. Rationale: spironolactone, a potassium-sparing diuretic and aldosterone antagonist, has been shown to improve survival rates and reduce hospitalizations in heart failure patients, especially those with reduced ejection fraction. It also offers renal protection by reducing fluid retention and preventing potassium loss. 250. Patients with heart failure who are not candidates for heart transplantation may be considered for a left ventricular assist device, LVAD, as a long-term treatment option.
True or false?
Answer: true. Rationale: LVADs can serve as a long-term treatment for heart failure patients who are not eligible for a heart transplant. LVADs help support cardiac output and improve symptoms, and they can significantly extend the patient's life expectancy and quality of life.